and then you can click login on the top right corner. This will take you to the login page. Once we log in, we will see the home dashboard. When you come in for clinic, your first step will be to access the schedule on the left toolbar below home. Click on schedule. The first time that you access this, you will not see any appointments. However, you will go to today's date. For the purpose of today's training, I will go to Wednesday, September 13th, and then click on this filter icon. I will select all appointment types and all users. So you'll only have to do this the first time. Once you've set those filters, then you should be able to see everything each time you volunteer. So this is an example for today. Our front desk staff will make appointments and take care of patient intake and also make sure that they change patient status from pending to arrived. So once the patient has arrived, this is when you will see this link pop up that says View Encounter. So we can see a few details here already. We can see the patient is in the lobby, patient name, date of birth, phone number, appointment time, link to the encounter for today's visit, which provider will be seeing patients that night, and what kind of appointment. So this is a return visit, and we know the patient has been here before. So we can access their chart by clicking View Encounter. And this is today's chart note. We can also see that our patient's information is in this top blue toolbar with these three dots that will allow it to expand if there's any other information we'd like to see. We can also access the Summary tab, Timeline, Profile, and Today's tab for this encounter. I'll click on Summary so you can take a look. Our summary will mirror the encounter with all of these subjects: any diagnoses, patient risk, social history, past medical history, medications, allergies, any encounters they've had with us in the past, and any future appointments they may have. So anything that is entered into the summary will automatically populate in the encounter and vice versa. I'll go over to Timeline. We can see over time all of the patient encounters. And then with this drop down, we can see any lab results we may have entered before, any appointments that might be pending, and any other one of these in this drop-down box. If we go over to Profile, this will show our patient demographics. It'll show their contact information, their address, their demographics, and contact for emergencies. So I'll go back to today's encounter. And then at the top, we'll see that we have some yellow notifications, and these will populate depending on the patient. So we see we have some vaccine reminders, some screening reminders, etc. Going down, we can see the encounter details. It's an office visit, soap note, today's date, the patient's age at encounter, and then we can see this drop down if for any reason the patient is seen by a different attending, we will change this to the proper person. And then we will see that this is the facility, and you will automatically be placed in the Luke's House facility. Next is Chief Complaint, where you can click Edit and free type as needed. For example, we will say this patient is here for a medication refill. And then you can just move on to Vitals. This table will show you the most recent encounters and vitals for all of the visits. We can click on the plus sign to enter anything that might be new. We know height will probably stay the same in certain cases, so you can just move on and add anything different. You can save as you go, but most importantly, make sure that you save at the top. So we'll see that this save will pop up here and we can save there. Also, make sure to save at the top right corner and we'll see that this green notification pops up. This can easily be lost and we don't want to lose our vitals. Next, we'll move on to diagnoses. We see that this patient has been here previously, so they already have some diagnoses recorded. If there's anything new, we can record, type in the diagnoses, we'll just select one of these. It will ask me to refine my search, so let's just go with the top one right here. And then we can choose to add some details. And then we can choose to either save this or continue and add a second. So I'll just save this one. And now we can see that it has popped up right here. We can continue to allergies. So basically a similar flow. We can type something in, whether it's a drug, food, or environmental allergen. Let's go with food. Can say apples, and then a measure of the severity, and then as many details as you would like, and you can either save or add another, and we'll just save. Can continue to medications, and we can also click record and type in a medication and then save if this is a medication the patient is currently taking. And we can continue to social history, where I will click record. The smoker status will pop up and you will select the one that is correct. And then we will follow with past medical history, where we can record any major events, ongoing medical problems, family history, any of these boxes as necessary, and we can click save. Now here we will find the SOAP note. We can also click record and choose to either do any free typing, or if you prefer, you can use one of our templates or create your own template in the template section that you can find on the home dashboard. So I'll just click our general physical exam, or maybe not. Let's try the admission H&P. And you'll see that there are some phrases right over here that if I just click on it, it will automatically populate in the text area. So I can just scroll and see if there's anything that I'd like to click, and it'll pass over. And then we can go to objective. Our template will change. I can click here, or I can choose to free type. And then go to assessment. And I can choose to click on the diagnoses tab right up here and add any diagnoses that may go along with this visit. And then I can save. And then go to plan, where I will also have some different phrases. And I am also able to prescribe medications if I choose to. And then I can save. Once we're done with the SOAP note, we can continue to our referral. So if for any reason our patient needs a referral to, for example, UMC, Children's Hospital, any of our referrals, we would just click Add and select our recipient. If you have any questions about this, the checkout desk will be more than happy to assist or to actually send the referral for you. And then we would just fill in all of these boxes, and we can even attach the note for today. We would just want to make sure that the note has been filled out prior to making the referral. And then you can either choose to send it or preview it before it sends as a fax. Now, lastly, if we had any labs done during this encounter, we would go to the top right Actions button, click down, and then find the Enter Lab Result section, and then we would click Enter Lab Results. Our lab, for the most part, will be Other, unless you are in the women's clinic, which will then be LabCorp, where we do our pap smear labs. So we'll just click on Other for today, and then we will add the test. You can find our labs above the physician desk or near the A1C, and you can find all the codes that go along with them. So we'll do a A1C, which I know from memory that the code is a 48. So the drop-down will show 48. And in this section, we'll just put a random number, and then we're all done. And then we'll just save this. And we want to make sure that we see this green saved notification. So now we can double check that the lab has saved. We can go to Timeline, narrow it down to lab results, and then we can see the top one right here has been done today, and it has one result. I can click on it again, and then I can see my result. And then you can access that anytime that you come back and you may see the same patient. So you can choose to review your encounter. Once everything looks good, you just make sure that everything has been saved. And your supervising attending will receive a notification in their task. So this is my task box. I will click. I see I have a few notifications. So I have a notification for the A1C, and I have a notification for the office visit. As the supervising attending, I will click and then be able to review everything. I'll be able to access everything that you have done during the triage, make any edits that I feel are necessary, and then as the attending, I will be able to sign and lock the encounter. I can go back to schedule. I will have, by this time, changed the patient status to in a room, so I'll just say they were in room 1. So once I'm done with my patient, I'll just make sure that I say that they're seen, and that will be it. Thank you for listening.